Overlord of Dagbon, Yana Abukari II, has dispatched a high-level delegation to the Tamale Teaching Hospital in a bid to mediate the ongoing strike declared by the hospital's doctors, led by Zangbaluna Dr. Yakubu II, chief of the Zangbalun traditional area. The delegation met with both the hospital's management and representatives of the Doctors Association of Tamale Teaching Hospital. In a message delivered on his behalf, the Yana acknowledged the dedication of the doctors, but appealed to them to consider resuming work, particularly emergency, walk-in and specialist services to help save lives. He also expressed his willingness to facilitate dialogue between the Ministry of Health and the doctors to find a lasting resolution to the impasse.
However, we implore you to consider the lives that hang in the balance. The cessation of emergency services has far-reaching consequences, and we fear for the well-being of those who cannot afford to wait. We appeal to your professionalism, compassion, and commitment to the democratic oath. Your dedication to saving lives is what brought you to this noble profession. We urge you, on the interim, to find a way to ensure the continuity of essential emergency services. We are willing to facilitate a meeting between your representatives and the minister to discuss the way forward. Our goal is to ensure that the hospital continues to provide quality healthcare services to the people of Dagbon and beyond. As my children and grandchildren, I urge you to consider the bigger picture and the impact of the strike on the community, a community that you and your families reside in. Let us work together to find a solution that prioritizes patient care and addresses your concerns.
Our Northern Regional Correspondent, Shawana Yusuf, joins us via Zoom with more. Shawana, the appeal by the Yana is very timely. Do you believe that you're there at the hospital currently? Are the doctors back to work?
Thank you so much, Eno. Currently, as we speak, the doctors are not back. I can confirm that they are in a closed-door meeting with the high delegation that came from the Overlord's palace. So currently, the meeting is ongoing, and everybody is hoping that by close of day, there should be a positive feedback coming from the Doctor Association.
Describe the hospital to us. Since doctors are not back, have patients heard about the strike, and are they still coming to the hospital to seek medical care?
Okay, so unlike yesterday, today the OPD, the consulting area, the emergency area is receiving very limited people coming in to seek medical attention. Yesterday, our visit to the OPD, to the consulting, specialist consulting area, showed that a lot of people drove in without even knowing that there was any industrial action here at the Tamale Teaching Hospital. So the crowds that were recorded, or the crowd that was recorded yesterday, is not the same today. Today, we have a lot of empty spaces here, PD, at the consulting area, unlike yesterday. So what it signals is that a lot of people have picked up the signal that there is an ongoing industrial action following the numerous media reports ongoing about the situation. So the numbers trooping in today has reduced drastically.
I wanted to find out quickly, if the doctors are on strike, what about the nurses? Can't they attend to simple cases like injections or patching up wounds?
What I'm picking, and from what I understand since yesterday, is that most of the nurses are doing their best to fill up the gap that has been left by the industrial action by the doctors, but they can't do much, though they work hand in hand with the doctors, but there are some limitations to the work of the nurse, but they are doing all they can. Those who come in with very critical cases, I mean, if they can attend to them, they do, but those they are able to let them go to other places to seek medical attention to, they advise them to go to other facilities. But this afternoon, I met someone who came all the way from the Savannah region, a Pulo for that matter. We call them Fulani. I hear they've been referred from that place to the Tamale Teaching Hospital. And unfortunately, because of the industrial action, they are still seated outside. They are not able to access the facility whatsoever because there is no doctor to give all these particular diagnoses that they have to go to this place or they have to be admitted whatsoever. So they are still waiting outside, hoping that before close of day, there'll be a positive news and they get to see a doctor and probably be admitted and taking care of their sicknesses.
All right, thank you very much, Shawana. And do keep your eye on that meeting for us. We'll follow up in subsequent bulletins.